Certainly, there are some programs and policies that can be easily implemented in a relatively concise and simplified way. For example, implementing a policy that ensures or changes the processes to track drug handling inside a healthcare organization could be seen as a fairly simple policy implementation. However, large systemic change or issues related to health system performance become much more complex to both implement and analyze. These societal wicked problems, as they have become known, are particularly difficult to address because of the complexity, uniqueness, and interdependency of the problems, and because in all cases they involve not just a single decision but a series of decisions on how to carry out the government's policy directions and goals. In the 1990s, Paul Sabatier developed a framework in order to produce a general theory of policymaking based on the idea that people engage in politics to translate their beliefs rather than their simple material interests into action. Sabatier introduced the idea that implementation is not, in fact, a separate stage, but rather, policy change is a continuous process that takes place within relatively stable subsystems in which coalitions of actors come together around deep core policy beliefs. These advocacy coalitions are groups distinguished by norms, beliefs, and resources. They are defined by their ideas and the high level of agreement on fundamental policy positions and objectives. These coalitions interact within policy subsystems, defined simply as a broader set of actors who are involved in dealing with a policy problem. This includes actors like civil servants, legislators, regulators, and so on. In any policy subsystem, a varying number of coalitions, policy brokers, whose role is to minimize conflict and produce workable compromises between coalitions, and a sovereign or government authority come together to make policy decisions and oversee the policy-making infrastructure. Sabatier argues that policy change happens in this framework either through or because of major external economic, social, or political events. In these cases, the event prompts a coalition to revisit its policy core beliefs, perhaps following a realization by many actors that existing policies have failed monumentally, leading to their consequent departure to a different coalition. The other main change comes through minor policy changes that take place within subsystems. Coalitions engage in policy learning, adapting the secondary aspects of their belief systems in light of new information. A model that has become more and more predominant in the healthcare field is the concept of implementation science. This fairly new and emerging concept has become a major topic in healthcare because of the observed and continual gap between evidence and practice. In other words, research produces new evidence showing a test or procedure or drug is a more effective approach to deal with a specific healthcare issue. However, practitioners are slow to change practice or adopt a new clinical protocol. Implementation science is a framework that seeks to understand and tackle this issue more specifically. More clearly defined, it is the systematic study of how to design and evaluate a set of activities to facilitate successful uptake of an evidence-based health intervention. Evidence-based refers to interventions that have undergone sufficient scientific evaluation to be considered effective and/or are recommended by respected public health or professional organizations. Implementation science seeks to understand the factors that determine why an evidence-based intervention may or may not be adopted within specific healthcare or public health settings, and uses this information to develop and test strategies to improve the speed, quantity, and quality of uptake. Implementation science focuses on the mechanisms of change to better understand and improve the process of change and implementation. Implementation science sometimes overlaps with concepts like knowledge mobilization and knowledge translation. Essentially, there are 5 foundational concepts that underpin the framework. 1. Diffusion. The notion that ideas, behaviors, and practices spread out in a relatively unfocused way through informal and formal communication channels over time. 2. Dissemination. An active approach to spreading evidence-based interventions to a target audience via determined channels using planned strategies. 3. Implementation, which is both an ideal and an endeavor. For an ideal, it captures research evidence and applies it to practice, reaching out through science or social science with a message about systems or organization-based levels of change. As a practice, translating research into implementable procedures recognizes that these stages do not happen automatically, often to no great extent and sometimes not at all. When implementation fails, it can leave behind a legacy not just of wasted economic resources, but also, at worst, of system upheaval, affecting health professionals at various levels and impacting patient care. When genuine implementation is successful, it can affect whole systems or services, positively improving practice and optimizing patient care. 4. Adoption. The degree of uptake of new ideas, behaviors, practices, and organizational structures. 5. Sustainability. The logical endpoint of implementable interventions once new knowledge and the intervention have been successfully applied and embedded. What has become evident is that policy implementation has become and will become increasingly complex. Policy implementation is not simply a process of executing a previous decision, but a complex dynamic influenced by the contextual environment of the policy system and subsystems, the goals and objectives of the policy decision, the goals, interests, and objectives of the stakeholders and key coalitions, the capacity and alignment of technical, financial, and managerial resources, and the ability of implementers to align through policy instruments or design key stakeholders through the implementation process.